Back in 2005, 2006, a number of the HIV sales team had approached me on how they could do some international volunteering. And at that time, I was fortunate to be able to connect with one of the few international volunteering programs that's available in Canada for private organizations. It's a program called Uniterra, which is a partnership between CESI, the Centre d'Études Coopératives Internationales, and the World University Student Council. The two of them have a very unique program where people who are working full-time in a company are able to take 2 to 3 weeks and go and work in a developing country. We were able to set up a program where Abbott became the first healthcare company to be able to participate in this program, and we initiated that program and began it in 2006.
In order to not be overwhelmed by the sheer depth of misery and problems in Africa, we needed to focus on at least one small area. And so there's a lot of work to be done. Decided to focus on what we know, and we'll start there and see where it takes us.
One of our first groups to travel overseas were a group of 4 people who went to Malawi, which included Mike Gregson and Matthew Steele.
Whenever you come back from Malawi, you can't help feel that I guess it's a connection to the people and the desire to help. You're only there for 3 weeks, so it's really a drop in the bucket as far as assisting them and making long-term change happen.
And so having the opportunity to volunteer and try to make a small difference has been very satisfying for me personally.
I felt that there was a bonding, and I felt that they were such good people in the community. They really were so interested in improving their life that I feel this bonding with Malawi.
Our first time we went there, we worked to Malawi. We worked with an HIV/AIDS volunteer organization providing care to stage 4 HIV patients in a very poor area who, unfortunately in Malawi, when you're terminal, well, obviously HIV is terminal to some extent, but when you're very close to death, they send you out of the hospital because they have to make room for somebody else.
Malawi is among the poorest countries in the world with an HIV rate of people infected in the neighborhood of 8 to 10%. The Abbott project that we worked on most recently, the hospital in Nkhamenya, is a small contribution to trying to improve the local situation.
That being said, there's a group of dedicated volunteers who we worked with who go out and provide care for these people.
The proposal was to build a new outpatient clinic at the Nkhamenya rural village. This new outpatient clinic would require an investment of over $100,000 Canadian.
So we thought we would put together fundraisers, fundraising events, fundraising drives, attract people to this story, because it really is, the story does the talking. We are just mediums for this particular story. And when people hear exactly what these people go through and the fortitude in which they face their daily issues, they can't help but to be inspired. And when they become inspired, they want to help. And when they help, they come out to the fundraisers, they donate, they spread the word.
And we were able to persuade Abbott to give us a one-time donation of $50,000 to match some of our fundraising efforts. And that went a long way towards reaching our fundraising goal of over $100,000.
And the $100,000 was wired down, and the construction on the new outpatient clinic at the Nkhamenya Hospital began in 2008. We have just returned in September 2009. It took about 18 months for the building to be completed, and we are very, very proud of the work that Mike and Matthew have done in building this new clinic. This is something that is going to assist the people of the Nkhamenya area. This is something that is going to be there for many years to come. And as the healthcare issues in Malawi are very significant and need to be addressed, this new clinic is going to be able to assist the 40,000 people that live in the Nkhamenya area by providing a much, much better standard of care in the years to come.
Well, this is a very happy day for me, and I would like to say that this is a milestone in the socio-economic development of this constituency as well as Malawi at large.
The objective here in providing a new healthcare facility to the people and the healthcare professionals in Malawi is that they will take this facility as their own. They will use this as an opportunity to train their local people, to be able to treat their local people, And our hope is that moving forward, we will continue to be able to provide healthcare professionals that perhaps could volunteer there, who perhaps would be in a position to provide some training. We'll also continue to try to help provide some medicines on an ongoing basis. But going forward, the real future of this project and the beauty of this is that it will be self-sustained by the people of the Nkhamenya Hospital area.